day for this live streaming. Our live streaming, just as we all know, our live streaming is every day by 10 a.m. All right, from Monday to Saturday, and on Sunday, um, we stream between 12 to 3 p.m. All right, so just subscribe to this channel and turn on your notification and be ready for our regular head tips, right? So in this particular channel, we always give you what you are looking for. If you are following us religiously on this channel, we discover that we have a lot of things that you can stand on. All right, we give you informations you can stand on to improve your health. So that's what we do in this particular channel. So I remain Health Educator Mike, the health educator of this YouTube platform. This is Healthy Living Global. All right. This is a platform where we share health tips, we promote health, we create awareness on some challenges that people are having around, and also possible ways to deal with them. All right, so that in the end you live a healthier life. That's what we do on this particular channel. So welcome to today's live streaming. Today is 13th of August 2026. So and we look forward to I'll see you guys regularly on this platform, all right, to interact with you always. Let us have an understanding of some things that we are expected to know as far as our health is concerned. So, we want to see how we can be able to take our healthy living to a global scale. You live healthy, I live healthy, the world will become a better place. So, all those things are influenced by decision making. All right, so we influence you to take a good decisions that is going to help you uh, maintain your health. That's what we do here. So if you are a religious member of this particular platform, of course, you must have a better life or live a better or healthy life. That's what we expect all our subscribers to be. All right, that's the goal. So thank you for being part of us today. Today we'll be talking about skin condition called vitiligo. All right, now when we started the discussion, we discussed that of acne vulgaris. We explained how it is and the whole thing. All right, we still discuss about that of psoriasis. All right, we have discussed about other skin condition, atopic dermatitis, contact dermatitis. All right, we discussed all of them um, in details. All right, of which we see that that of acne vulgaris can show in a form of pimples, it can show in form of dark spots. So, and there's many things that could cause it. To explain everything on live streaming that particular day. Then that of contact dermatitis, atopic dermatitis. We say that atopic dermatitis, that is a genetic disorder in which the immune system is attacking the cells of the skin. We explain everything about that. Even that of contact dermatitis is whenever it's still a disorder, but this one happen whenever the body come in contact with allergy. All right, and all those things, both contact dermatitis, atopic dermatitis, is being triggered by maybe harsh soap, all right, stress, and other things, right? When you use some perfume that are too harsh, all those things can trigger up that dermatitis, of which we explain that dermatitis is just what inflammation of the skin or irritation of the skin. All right, so that is what it means. Now we even discuss about that of psoriasis. We explained it better in our live streaming yesterday. We see explained that of tinea, which is ringworm, all right, and how um, the body is can how it can be able to show in the body, all right, even the one that happens the all over the body, which we call tinea um corporis, right? That of the scalp, we say tinea capitis. That of foot, we say tinea pedis, and the growing is Tanya Cruri. So we're explaining everything on our live streaming. And this one was yesterday. So we have been following up on these skin conditions. All right, let us just know the differences so that if you are having the one that is caused by bacteria, you strictly use antibacterial medication to attack it. If you are having the one that is called by allergic reaction, use allergic reaction medicines to tackle it. If you are having the one that is caused by fungi, all right, like ringworm, use the one that works specifically for that purpose and tackle it. So for your information, I posted it on this particular channel today, what the NAFDAC is telling us. All right, just an update that just came up recently, say that ketoconazole, all right, ketoconazole tablet um, have been they have officially discontinued the registration of ketoconazole, all right, due to the fact that recent discovery is saying that it is causing what we call hepatotoxicity, which is to say that it's toxic to the liver, all right, it causes liver failure. So I usually tell you guys about all these medications that you see, all right. That's what we call um post-marketing surveillance, right? So in all this clinical trial, the other trial, when they finish all the trial, they push it to the market. It's expected that whenever you use the drug and receive any adverse effect, you report back, let the company be aware. That's what we call post-marketing surveillance. They want to still know how it works and do an update or make some amendments when it comes to the drug. So now, for over the years, ketoconazole have been in use, but recent discoveries is saying that it is toxic to the liver. So now what are we expected to do is to cease the use of ketoconazole, use alternative intraconazole, fluconazole, even crisaphovine. All right, so you can use any of them as alternative whenever you are treating this Tinea pedis, Tinea corporis, Tinea capitis, Tinea cruris, any of them, which is ringworms in other parts of the body. So that's how it works. So you actually need to do better by following the directive. Now, today we are discussing about vitiligo. What is vitiligo? So it's something that everyone we need to know about this. Even people that are having this condition do not know that they have this condition. All right, they're not aware. And most of them, all right, most of the vitiligo that you are seeing, or which I'm going to explain today, may not start from childhood, all right. Along the line, maybe the person have reached teenager age or even young adult. Before you know, you begin to notice these vitiligo signs, and the person will begin to marvel and how did this one happen in this way? Not knowing that this is a genetic disorder, all right, that have caused an autoimmune disease. All right, so now we say, what is vitiligo? Vitiligo is an autoimmune disease in which the immune system, all right, the immune system, sorry for the interruption. All right, guys, sorry for the interruption. Now, I say vitiligo is a skin condition where the immune system is attacking the cells of the skin, and let us be precise about this cell, is attacking the melanocytes, all right, which are the cells that are forming the melanin. It's melanin that gives you this particular skin color you have. All right, guys, sorry for the interruption once again. Now I say, what is vitiligo? Vitiligo is an autoimmune disease in which the immune system attacks the cells of the skin, destroying the melanocytes, right? Which is to say that it's going to reduce the melanin on the skin. And when this happens, it will lead to reduction of pigmentation. Pigmentation is what makes your skin color to show. Now it will now show a white patch on your skin. All right, some people may not understand what is happening to them when they are having this white patch on the skin. You may notice it around your body, right? Even in between your hands, and sometimes it can even discolor the oral part, all right, making it to have a different color entirely. All right, so this is vitiligo. It doesn't scratch, right? It's not itchy. It doesn't show anything like itches or scratches or anything. It doesn't show any patches, all right, or maybe raised patch. No, what it just shows is what discoloration of that particular skin part, right, giving you a different color from your normal regular color that you have. So what it will do is that it's going to reduce that pigmentation, the pigment, which is when it have destroyed the melanocyte on the skin. All right, so this particular sign is more visible for people that are dark. For people that are very fair, all right, very fair in complexion, they may not notice it that much because they are fair. So even if the melanocytes have been reduced, so it will still almost be the same like their complexion because they are fair. All right, pigmentation is what causes that particular, in fact, more of that dark complexion. Now, for those that are dark, when that immune system destroy the melanocyte, before you know it, it will show a white patch on the skin. All right, when it shows that white patch, you are going to see it more visible because the surrounding environment will be dark. All right, or maybe people that are chocolate in color, the surrounding environment to be chocolate, leaving only that particular place to have a white patch. All right, it can happen in different areas. All right, it can happen in one side alone, which sometimes can be difficult to treat, and can happen to other areas. Most of the time, the issue may not even clear, all right, totally. All right, sometimes you may just need management and even to take care of it. We are still going to discuss it in this video. All right, so please, I want us to just understand this um what this vitiligo is all about. All right, vitiligo is not a fungal infection, it's not a bacterial infection, it is not contagious, it's not something of which you have today. You say you're having vitiligo, okay, that you want to, you will be very careful so that you don't transmit it, let another person not contract vitiligo from you. No, 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 no. All right, no one can contract vitiligo from you. It's an internal thing, right, that have led to the destruction of the melanocyte. When once the thing happen, before you know it, the skin will now have white patches on the skin. Now, if you want to handle that particular condition, right, of this vitiligo, it's actually important for you to know, remember the cause. The cause is what? Autoimmune disease. Even though there is other things that can be the trigger, all right, other things can be trigger. Maybe if you are stressed, right, to some extent, or maybe you are too exposed to sunlight, all right, which can still even complicate the issue the more, or which I will still tell you what you are expected to do when you are exposed to sunlight. So if you are stressed, or even using harsh cream, or using harsh cream, all right, all those things can be the triggers, but the main cause of it is a sort of immune system, all right, attacking the cells of the skin, all right, making it to have this white patch all over the body. All right, and sometimes it may not even be all over, it may just be specific area or just one particular area. There's a lot of people that get this twisted. In fact, they don't even know how to explain it. Even if you go to the healthcare center, all right, if it's not an experienced healthcare center, they may not be able to know how to diagnose it, right? They may tell you maybe it's something that burn you in that place, all right, or something. They'll just find something and explain to you. Another thing that can be um a trigger is chemicals in the environment, right? Exposure to chemicals in the environment can still be a trigger to that particular autoimmune disease, all right? That can still lead to that immune system attacking the cells of the skin to give you this vitiligo. All right, so all those things are the things that you're expected to know. When you have this vitiligo, how are you expected to solve it? How are you expected to go about the treatment? All right. To go about the treatment, some some um some experts may recommend it. They'll say, okay, if that particular vitiligo, let's say for instance, you are dark in complexion and this vitiligo have taken almost all over your body. If you see people that are having vitiligo, if you see people that are having vitiligo, you will understand what I'm talking about. All right, because people that are having a very serious one, severe one, almost all their whole body, they are dark in complexion, but almost all their whole body have turned to white because of this hypopigmentation, right? Reduction of skin pigment. So now, one of the approach to treat this particular vitiligo is even to reduce, which is hyperpigmentation, to use some steroid, all right, to clear up the other part that is still dark, all right, that still have a lot of pigment, so that the skin will become unique. Because I tell you, this particular condition is capable of making you to become uncomfortable anywhere you are. It will make you to lose confidence if you are in a public domain, all right, because you will not understand how your complexion works. You don't even understand yourself anymore, all right. You having white patch here, white patch here, it will make you not to be unique, all right. So now some people will go in the treatment approach in this way by um using steroid creams that will still exfoliate the other parts that are still okay, all right, so that it will make the whole thing to be unique. But before you take that decision, you must check the extent of damage, all right. If the damage is not too much, you can't take such decision, right? It will be more dangerous. Of course, when you do that, you should be considering other things that will come after, like in the case of skin cancer, exposing yourself to sunlight, and even other these things, damage that it will cause on your skin, all right, if you take that decision. All right, now you can use that particular method if it have taken almost the whole part of your body, all right. And also you can still use some medicines that will suppress immune system suppressant, all right, can still go a long way in helping the condition, right. You can still use cream that improves pigmentation, right? It's still there. You can still use that one if it's not much on the body, so you can use that one um kind of do what we call a depigmentation, all right. So you can still use that one and it will help, all right. So now um when you are done with treatment, let us talk about how you can be able to prevent it, or in fact prevent it from happening, right, from occurring. Because if it's, we say prevention is cheaper than cure. Now if you want to prevent it from occurring, is for you to reduce the triggers, right. Reduce the triggers, and also of course it's an autoimmune disease, so which is to say that the triggers must be reduced, like excessive stress, exposure to chemicals in the environment, all right. Even if you are using um, creams, right, topical creams, don't use the harsh ones, all right. All those things can lead to the triggers, and before you know it, a lot of things will be happening on your body. So all those things is something you need to take note of, right, as far as vitiligo is concerned. So now um if you are having vitiligo, please take note of this. You are having vitiligo, just know that what you are expected to use some protection. Always, every time, always. You're expected to use some protection. Why did I say so? I said that vitiligo is what? Autoimmune disease in which the immune system attacks the melanocyte, all right, which is what is making the pigment of your skin, all right, which is to say that when once it attacks the melanocyte, it will reduce the pigmentation of the skin, making the skin to have white patches on the body, which may be in different areas of the body or maybe a specific place. All right. So now, um, you must try as much as possible to use some protection if this particular thing happens, because of what? That some protection will enable your skin, because once your skin pigment is destroyed, all right, it will expose the skin. It's just like exfoliation. It will expose the skin to sunlight, all right, to expose it to sunlight. And once you expose it to sunlight, you in fact you are at a very high risk of developing skin cancer. Very, very high risk. You are at a very high risk of developing what we call exogenous ochronosis, which is when you are having blue black complexion as in form of leathery. I mean, your skin will look like a leather, right? Looking very dark. I think I posted something like that on my channel. If I haven't posted it, means it's still an upcoming video where a woman used a harsh cream, all right, that have hydroquinone, mercury, and there's some strong steroid, right, which have caused exogenous ochronosis and also lead to hyperpigmentation. All right, so all those things are what happens. So now, if you having this vitiligo, all right, you're having vitiligo condition, which is to say that that particular skin layer, the melanocyte, have been destroyed, so it will lead to the pigmentation will be very low, all right, making you to have white patches all over the body. And once it happen, you have exposed your skin to the sunlight, all right. So especially if you are someone that works, your activities is outdoor, all right, you do a lot of things under the sun, so you have exposed yourself to the sunlight, and before you know it, it will begin to develop different skin condition like that of skin cancer, exogenous hyperpigmentation. All those things will begin to come in. So which is the reason I advise, if you have your prevent this particular vitiligo from forming. You can be able to prevent this vitiligo. In fact, you can reduce the vitiligo anyway, though you cannot prevent it with SP30. You can reduce the impact on the skin. All right, you are going to reduce the impact with this SP, so it will protect your skin, all right, helping you to be like a cover. It will help you to take cover in all those harsh environment or harsh effects, all right, that the sunlight will give you as someone that having vitiligo. So please take note of that. If you're having vitiligo, it's important to do the needful overview of this vitiligo issue, all right. I'm just creating this awareness, although just like I've mentioned before, we still need a teaching aid so that I'll be seeing what I'm showing you. But at least with this explanation on this vitiligo, I believe you understand what I'm talking about. Or if you share this video, people that are having this vitiligo signs will understand what I'm talking about. All right. Most of the time, it may not be curable, right? Some of the cause, sometimes can even be unknown. It will just develop in that way. All right. But is mostly an autoimmune disease, all right, in which the immune system attacks the cells of the skin, all right, reducing the melanocyte, all right, which in turn will still reduce the melanin, making you to be what? Hypopigmented. All right, so which is to say that skin pigment, the cell that are making up your skin color will be reduced, exposing your skin to sunlight, making you to have white patches on the skin. All right, so it's an autoimmune disease. It may be mild for those people that are affected, just like I mentioned from the very beginning. and maybe mild for them, due to the fact that those people, they are fair already, right? People that are very fair, you may not notice it, it will not be that visible. But that of the dark complexion, when the surrounding environment is dark in complexion or chocolate, and there is the person can actually seek medical help. There's some ointments, all right, that you can use that will help restoring the pigment, all right, of the skin. And also with this SPF 30/60, it will help and reduce the harsh effect of sunlight, all right, on someone that having vitiligo. It's an autoimmune disease. So let everyone know about this particular vitiligo and take note of it. It's not something that is contagious. You cannot stay with someone like having vitiligo and they say you have contracted it. No, you can't contract vitiligo from anyone. It's an autoimmune disease, something that happened within your system, right? That is what happens when it comes to vitiligo. So please let us take home this message, very important, about this vitiligo. And also let us know that this is what awareness creation ground, right? Please, if you haven't subscribed to our YouTube channel, do well to subscribe to our YouTube channel. If you have not followed our page on Facebook, please do well to follow it at once. So please, if anyone have any question about the vitiligo, I've just created an overview of vitiligo, what causes vitiligo, the signs of vitiligo, and even how to go about the treatment. Though I will still advise you, if you're having vitiligo, still seek medical help, right? Meet a healthcare professional. Why did I say so? If you meet a healthcare professional, probably your own condition may not be vitiligo. You may be misunderstanding it. All right. And please, if you have not still been able to differentiate the vitiligo with other skin condition, means you're not following what I'm saying. That is it, right? Because I say that vitiligo does not have any raised patches, all right? Which what I mean by raised, like that of ringworm, tinea, all right? You are going to see a patch or scaly patch that is round and it's going to be raised, which is to say it have a bump or it have an offshoot, all right, from the skin. But in this vitiligo, it doesn't give any raised rash or patch. It doesn't give anyone raised. It will just have what? White patches on the skin or white discoloration. It doesn't itch, it doesn't scratch, it doesn't do anything. It's not painful, nothing. It will just remain in that way, in that form, right? Discoloration, it can happen in one part of the body, it can transfer to other part of the body, but it's a result of autoimmune disease where immune system is attacking the melanocyte on the skin, making it to be what? To be hypopigmented. When I say hypopigmented, for the pigmentation of your skin to reduce. That's what happens in vitiligo. All right, so please take note of this, so that whenever you go to healthcare center, you want to go for any diagnosis, at least you can be able to talk with your healthcare provider and seek medical help. And please note it, this can be very distracting. It can make someone to lose confidence. All right, so if you notice it in one part of your skin, seek medical help. Talk with your healthcare providers. They can give you something, a medication, even topical ointment that will help and reduce the progression, all right, of this, because this is the goals of the treatment, reducing the progression of this the protection of the skin, all right, that is already exposed or that's already depigmented, or that the pigmentation have already reduced, right? Protecting it from the harsh environment like that of sunlight. So that is the goals of the treatment. I need to know how you are going to go about it. So seek medical help so that you talk with your healthcare provider. You know exactly, once it is diagnosed and the healthcare provider confirm it that you are having vitiligo, all right, they can give you something that will stop the progression and also protect your skin from damage, all right, whenever you having such a thing. And also, if you are someone that have the thing have gotten all over your body, almost the whole part of your body, some professional can say, okay, in that case, let us depigment, all right, or reduce the pigmentation of the remaining parts so that you look unique, because it reduces your uniqueness, all right, when it comes to your appearance. So please, please, if you have any question, just on the comment section, please, guys. We're going to continue tomorrow by 10 a.m. We're going to continue tomorrow with other interesting health tips I will have. All right, so we have a lot of them right on ground. So do well to join us tomorrow, guys, for other interesting health tips. Sorry for the network glitch, sorry for the network interruption. I'm going to do better tomorrow by God's grace. So see you guys tomorrow. Thank you.